let's start with a great point of agreement that I think all four of these gentlemen have. In fact, Joe Brennan of CBIA agrees with them. Paul Filson of the Service Employees International agree with them that the solution to the budget crisis is shared sacrifice. The rest is just details. So, with the time we have, let's try to get to some of those details. I'd like to start with a very quick question about trying to find out if all four of the legislative leaders are on the same page, at least when it comes to the scope of the problem. Governor Malloy teased Speaker Donovan in his remarks. I think I'll begin the same way. Mr. Speaker, you were quite optimistic last year in talking about the ability perhaps to get through the crisis based on economic recovery, stimulus dollars, and whatnot. The governor, who was pretty nice today, a month ago, his view of the people who are optimistic, he didn't use any names, he said it didn't mean that they were evil, it just meant they were wrong. So let's start there. Gentlemen, starting with you, Mr. Donovan, how do you see the scope of the problem? Is this something that we can muddle through by praying for recovery, doing some trimming here and there? Or will this require what the governor has said will require systemic changes and structural changes?
Here we go. Mark, I think, there never was muddling through, and that's where I disagree with you, and there never was praying for things. There was a lot of hard work, and we're at the point we are now with 3 consecutive balanced budgets, and this year even ending on 2011, ending on a small, very, very small surplus depending on where we are. But it got us through some of the 3 worst years that our state has faced. We had, as the governor said, we had hoped that there would be more money coming from the federal government. Certainly that helped us out in the past 3 years. We had a rainy day fund that we had set money aside. That helped us out in the last 3 years. We had state employees kick in dollars. That helped us out in those 3 years as well. Those things are no longer there, but they got us through there. Now that we are at a certain point where I heard today that the unemployment figures are going down, that retail figures are going up, those are good signs. And I think the governor talked about a new hope of moving forward. I share that, and I think everybody in this room shares that hope that things get better. But we know we have to do it together. We have to figure out ways to do it together. Some of the parts of the recovery that got us through are not there. So as the governor said, it has to work with all of us. So whether it's he uses the word shared sacrifice, I like to use the word shared contribution, but we're all in this together. And some of the concerns I have about lowering costs, such as energy costs, I heard Mr. Hess talk about energy costs and healthcare costs, are some of the biggest concerns we need to do here, we need to work on in the state. If our energy costs are 15% higher than our neighboring states, we should figure out ways to do it. And I thank Danny Moore for saying there's ways that we can work together. That's one way to do it. In terms of health care, if we can reduce the health care cost and work with our industries to figure out ways to reduce costs to businesses. If I'm a business and I reduce my health care costs, if I reduce my energy costs, I can hire more people. If I'm the state of Connecticut and I can reduce my health care costs, I can reduce my energy costs, that reduces the deficit. We're all in this together. Let's work forward, move forward.
Would any of you care to put a finer point on what shared sacrifice might mean? I think most people take it to mean that you're going to tick off some of your constituencies. So who wants to jump in and give us a sample of that? Mr. Cafero.
Well, I applauded the governor for using that term. And I certainly want to give him the benefit of the doubt. The man has been in office all of 2 days, to give him some time to define what shared sacrifice is. I probably have my own meaning. You folks have your meaning, but others have their meaning. And as you said, the devil's in the details. For instance, in my very simple opinion, shared sacrifice means you give up something that you already have, or you have to, if you are receiving a program, maybe the benefits of a program, you might not be able to receive all those benefits. If you have certain benefits in the course of your employment, you might have to give some of those up. That to me is sacrifice. There's another kind of sacrifice as well. Giving more of the money that you have towards taxes, that's a sacrifice. But I think that, especially with the folks here, they would argue, I believe, and I would argue, that over the past several years, there has been sacrifice and continues to be. We live in one of the highest tax states in the United States of America. And most of you have seen your profits dwindle, your work hours dwindle, your workforce dwindle. You have made that sacrifice. In the public sector, however, I'm not sure we have made that sacrifice. Not one state employee has lost their job involuntarily. We have actually grown a budget and not reduced it. No one has gotten a nickel less of health benefits. No one has not received a pension payment who is entitled to it. There has been very little, there hasn't been a program that I know has been consolidated or eliminated in state government. There has been no sacrifice to date in the public sector. And what I'm especially concerned about is I read just the other day in Politico magazine, newspaper, excuse me, that, quote, in a central headquarters in Washington, the new union campaign will attempt in particular to prevent a split between public and private sector workers and to defend the public workers from sharp cuts to their pay, benefits, and the right to bargain collectively. The effort hopes to co-opt the reform mantle to make the case that while workers are willing to give back benefits, shared sacrifice, meaning taxes on the rich and corporations as well, should be the order of the day. Now, I would submit to you, we've been down that road. It's now time to make some sacrifice in the public sector.
I'd like to jump in, Mark, a little bit.
If I could jump in, Mark, and I don't know if I should refer to you as the Dean of the Press Corps.
No.
But, I mean, first of all, as to your first question, you know, if you look at the last two significant economic downturns that we had in 2001 and 1991, and then you fast forward 2 years after those downturns, there were significant improvements in our economy. After both of those economic downturns, job growth was back up, revenues were significantly up. This time around, we are well beyond 2 years into this recession, and we have not seen that level of recovery as to job creation, certainly, but also as to revenues as well. This is a different animal, much different than 2001, and much different in truth than 1991, and that was a watershed period too, because folks were talking about the end of Connecticut as a defense industry state with all those jobs at Electric Boat and all of its subsidiaries and folks who contracted with defense contractors. The economy was changing, and people were talking about jobs never coming back again in the aftermath of 1991. So in many ways, it was similar, but it was nowhere near as severe as what we are facing right now. So it is going to require significant change and structural change. And even if the problems were not as deep financially as they are, I would argue that we ought to take this opportunity to make those changes going forward so that we can not muddle through for a year or two, but we put the state on a pathway to economic recovery for the next decade and beyond.
Does that mean that you believe there will be an attempt to control some longer-term expenses? There were decisions made going back to Governor Grasso and Governor Neal that are in some part responsible for some of the employee costs. Representative Cafero talked about the cost of labor, but the reality is a lot of the things that people complain about, pensions, retiree health, if you and Governor Malloy try to change those this year, it's going to benefit probably the fourth term of the Malloy administration.
Well, at least the second term. Governor Rowland locked us into a 20-year agreement as to benefits for state employees. I think there's another 4 years to go or thereabouts on that. You can change pension obligations going forward for a new class of vested employees. Legally, as far as I understand, you can't go in and change it as to folks who are vested presently. So
What's the role of the
there are things we
legislature?
can change going forward, but you're absolutely right, Mark. There have been decisions made in the last 15 to 20 years that do limit certain options in certain areas. But that doesn't mean that you give up. That doesn't mean that you don't take a look at every other aspect of state government and the constituencies that depend on state government to get savings and efficiencies.
What's the role of the legislature in trying to frame that debate with state employees? Governor Rell, in the last concession package, she did negotiate a change. The rule of 75, that years of service and age must add up to 75 before you can retire. There are some states, the rule is 80, 85. I think in Virginia, they're up to 90. But you four gentlemen, is that your business to somehow pressure the governor, or is that totally in the executive hands, do you believe, on what he should be doing with the state employees on retirement?
Well, I don't believe it's, got to turn my mic on, I think it is on. I don't understand how we could cede all of that entirely to the executive branch. The reality is, the situation we're in right now is as dire as Governor Malloy says it is. Quite frankly, in April of 2008, Representative Cafero and I stood up and said, things are bad and they're going to get much worse. So it is welcome news to hear our new governor acknowledge just how bad things are. It's not just that we have a $3.5 billion budget deficit. It's not just that we won't have extra federal money or a rainy day fund to get us out of it. It's not just that we have too high of an unemployment rate. It is that we also have these tremendous pension obligations and OPEB obligations that are unsustainable for our citizens and our economy going forward. So as a state legislator, how could you ignore that issue? This is a huge issue that is looming over the heads of every citizen of the state of Connecticut. Every city, every town, every state in our country, quite frankly, is going to have to deal with this issue, and we have to deal with it right now. If we don't deal with it in the next 4 years, we will have made a huge mistake. Let me just say one more thing, because you talked about where are we all on the same page. And I don't know if Governor Malloy reiterated it today, but I want to applaud him for one very significant thing. In his very first speech, Governor Malloy said, and I think this is an exact quote, "We have an economic crisis and an employment crisis, both fueled by an unfriendly employer environment." Bravo. That's exactly what we have done as a state to businesses. And it is time we reverse course and create a more friendly employer environment so we can lower that unemployment rate. The speaker mentioned some of the national figures. Quite frankly, I don't think the outlook is as rosy. Nationally, the unemployment rate went from 9.8 to 9.4%, but I think most people would argue those are seasonal holiday jobs and people who have stopped looking for jobs. And in fact, new jobs created nationally were much lower than economists had predicted. So I don't think we are even close to out of the woods yet. And one of the things we must do with this new governor is we must say to the people across the state of Connecticut and employers that there will be stability, that we are going to address our problems, and that we are going to create an environment that will want you to stay here and grow jobs here long term. We cannot have UTC moving 1,000 jobs out of the state. We cannot have Marlin Firearms closing its doors in North Haven, moving to North Carolina, not because their business is shrinking, but because they want to dramatically expand and grow their business. Those days have to end. Because when you talk about shared sacrifice and you talk about are there going to be cuts, are there going to be tax increases, it doesn't take a rocket scientist to understand that if you have more people paying taxes, you're going to get more revenue without even raising them.
The sales tax hasn't been touched since 1991, since Governor Weicker lowered it, and that's all what you remember him for, right? CBIA and some other groups has said, yes, we're willing to accept shared sacrifice, but the concern is that it may intersect and bump up against how to improve the business climate. So do you believe there's movement on the sales tax, both in rate, which is the lowest in the region, but also the exemptions? There are about $3 billion worth of sales tax exemptions, which if they all went away, theoretically would almost take care of the deficit. So are there any specifics here today where sales tax...
Can I just correct you on that just quickly? because people talk about the $3 billion in sales tax exemptions. And I think if you want to take an honest look at what those $3 billion are, first of all, I just think the premise that we're losing $3 billion because something's not taxed assumes that it's government's money, not the people's money. So I really bristle at that. That's why I interrupted you. But the single largest quote-unquote tax exemption of that $3 billion is the gasoline tax of 25 cents. Because if you applied the gasoline tax the way it is written, you would tax 25 cents on the sale of the gasoline to the gas station, and then 25 cents or whatever it is on the sale of the gasoline to you and I. So that would double our gas tax in the state of Connecticut. I don't think anybody wants to do that. So when you chip away at some of those quote-unquote exemptions, it's not $3 billion. It's more like 400, 500
There's no
million
question that
dollars.
some are easier than others. I mean, certainly, I don't think we're going to see food taxed at 6%. But anyway,
Or
back
prescription
to,
medication.
or prescription
is exempt
medication.
too. So I think what we ought to focus on, Mark, though, is the real.
Or
the
massages or boat
The real
storage
things
or
that aren't
permitting.
taxed that we
No,
may
but that,
want to
Mike,
tax.
the question, because this is a short time, are there any specifics that you say are absolutely must be maintained to help the business climate? Or are there those that you can identify here today that say, absolutely, you're in favor of dumping the exemption to help raise some money?
I think, and this is an example that gets used fairly often, but if you go and you have your engine of your car worked on, you pay sales tax. If it's your luxury yacht, you do not. Storage of a yacht, same thing. We ought to be working with Rhode Island and New York to have some consistency on those types of things, because folks will say, well, if you do that in Connecticut, people will just sail their boat to Rhode Island or whatever. I think all the states are in the same kind of fiscal mess dealing with this national recession right now. So those are some examples of I think, areas where we could look at. The film tax credit, quite frankly, I think that there has been some success, but I think the emphasis there ought to be on bricks and mortar and full-time jobs in the state of Connecticut, as opposed to folks who come through the state of Connecticut for 2 weeks and then move on. So I think there are areas that we can look at where we are losing not necessarily billions of dollars, but tens of millions of dollars. And you know what? That's where it's going to be. There's not a magic bullet solution where we can say, there's the $3 billion of savings we need, and now we're done. It's going to be 10 million here, 50 million there, 3 million there in every single department and agency and area of state spending in the general government side, and the tax spending and exemptions and loopholes on the other side.
But Mark, you can't just look at one thing. I agree, there is no silver bullet, but there has to be a strategic plan. You can't, as a legislature, one day come out and say, business, we need to help you. We're going to have a jobs bill. Everyone applauds it. The next day have a press conference and say, we're going to increase a corporate surcharge on you for 10% for the next 3 years, and then we're going to have paid sick days, paid sick leave mandated on every one of your businesses, and look at those things in a vacuum and say, we did good by these things. It has to be a strategic approach globally. So if you want to look at the sales tax, you can't look at it in a vacuum. You got to look at some of the other things we did. For instance, it's one thing to say to municipalities, for instance, that, hey, we're going to do no harm. We're not going to decrease your ECS formula, et cetera. But then heap upon them unfunded mandates like in-school suspension, et cetera, raise the age, et cetera. You can't do one thing at a time and say you're helping this guy, you're helping that guy, and govern press conference by press conference. There's got to be a big plan here. We're hurting now.
What's the best thing the state can do as far as stability on its revenue structure? There's going to be tax increases. The governor has made that clear. Connecticut's top income tax rate is higher than Massachusetts, but it's lower significantly than the top end for New York and New Jersey. Is that where we should look, Speaker Donovan?
Well, we've looked at that in years past. The Democrats have put out a budget last year that had minor increases on the upper level on income tax. It was vetoed by the governor, and as a result, in order to balance budget, there was more borrowing than we wanted to do, and we thought borrowing was not what we wanted to do, but we had to have a budget. So, as always, you look at what we need to fund, and we need to make government as efficient as possible and make cost savings. If we can reduce, again, our health care costs, we could have significant savings. We're going to be looking at revenue. We always do. And I think the point is we need everybody's input. What makes sense? I know when we were looking at the corporate surcharge a couple years ago, Cam Staples, the chair of finance, he brought in the business industry and said, what makes sense? What can you live with? What is possible? There were proposals that were on the table. Business says, no, we don't like those. This one we've had in the past. We've paid it off. It's a limited time period. We can live with that. And I think, as the governor said, we have to have that dialogue. We have to say, okay, what are we going to do? What is the contribution that we have to do to make our state run? The governor talked about all the different services the state provide, services that people in this room rely on. People talked about community colleges. People asked questions about transportation. What are we going to do? How do we fund those things? We have to have that discussion. We welcome everyone to come into the General Assembly, talk to the Finance Committee, talk to me, talk to everyone, and say, these are the ideas we think make sense. If you do this one, that'll hurt us. This one, we think we can live with that, and if we know that's going to happen, we can rely on that, we can move forward. I think one of the earlier speakers talked about a consistency. If people know that this is what we're going to do, this is the cost, and this is what we get from that cost, I think that's important in dialogue as we move forward.
Well, I would just say, and I think the speaker's right, that we have to ask for all that input. But I wouldn't blame the audience here to say, well, we've been doing that. And so, by the way, as special interests and special programs and government agencies. And the folks here might say, how come they always win out? How come when they go to tell you, don't touch this and don't touch that, you listen? But when we come and tell you, don't do this and don't do that, you might hurt jobs, you sort of say, hey, sorry, you got to suck it up. And then we come back a year later, having not touched one sector of this state, and we say to the other sector, you got to give up some more. I mean, we raised the tax on corporations, we raised the tax on our wealthiest citizenry because we said we wanted them to pay their fair share. That implies that once we did that, they were now somewhat paying their fair share. It's nary a year later, and we're coming back saying, you know what, it's not fair enough. We're going to hit you up again. And yet they will look and say, but I don't understand. What did you do in the public sector? Did you try to trim your belt? You're asking us to do that. So that's why it's got to be more of a global approach. It's easy to say, yes, we want to hear all your ideas. We'll hear them. We got to listen to them. That's what we got to do.
Well, I just wanted, Larry keeps bringing this up, and we did have other people did contribute in the past. I mean, I brought up state employees. For those who don't know it, I like labor. But they did give up. They took unpaid days, so they cut into their wages. They paid more for their health insurance, and they actually found different ways to save. There was an early retirement. I don't think we want to, in a time of recession, lay people off. Oftentimes, government hires people during times of recession, but we didn't lay people off. People took early retirement. We reduced about 3,000 people from our workforce. That's a significant thing. And one of the problems people may have in getting permits through, et cetera, is because now we have a reduction in workforce. So the fact that we said to people, you're not contributing, they did. And across not only state employees, but municipal workers as well, took cuts in pay, paid more for health care, changed their pension systems, et cetera. So I think the idea, again, is to have more of a cooperative stance. When we were in this recession, the state employees gave, the municipal employees gave back. I think it's a time for cooperation. If we're going to move forward in this state, we rely on so many things. We're all in work in a community. Let's figure out the best way to do it. Let's have that dialogue and move forward. I don't think it serves us at this point to be saying this person gets that and that person gets this. Let's figure out what makes sense for the state of Connecticut. And I'm going to talk about this one point that I bring up, and because it was part of the budget negotiations, and just to give you a feeling of what's going on. There was a proposal to cut dental care for low-income senior citizens. Low-income senior citizens. Some of our grandparents, et cetera, are on Medicaid. People go into nursing homes, et cetera. That's a large part of our budget. We're not going to let them close down the nursing homes. But it was to get rid of dental care for low-income seniors. So I went to the free health care clinic they had at the Aetna, and I asked one of the dentists. The state said, the governor said, we will do emergency care. So I said to the dentist, what is emergency dental care? he says, well, first of all, your teeth have to hurt so badly that you go to the emergency room. The state wouldn't do any other care for senior citizens. Only if your teeth hurt so badly that you have to go to the emergency room. And I said, okay, that they go to the emergency room, because now you know, though, that when they go to the emergency room, we will now reimburse, the state will now reimburse at the emergency room rate. I said, that's high, right? He goes, that absolutely is. So I said, well, what kind of care do they get when they go to the emergency room? Do they pull the tooth out? Do they fill it? What do they do? He goes, no. We give them an antibiotic and a painkiller. An antibiotic and a painkiller. So in the year 2010, the policy for the state of Connecticut for senior citizens who've contributed all our lives to make our state, who are low income, and maybe their savings, they didn't have enough savings, this was going to be the policy in the state of Connecticut. Now, the dentists didn't like that. The hospitals didn't like that. And I don't think that's a good policy. But that was one of the policies that was being proposed to balance our budget. To the point that a reporter said to me, Chris, isn't this a luxury proposal? To me, that's not a luxury proposal. That's not a luxury proposal. When I go to the dentist, I don't say, hooray, I'm rich. That's not a luxury thing. This is a basic thing for the people in our state. And I bring it up because nobody here would agree that that's a good policy, but that's the kind of policy. So we're not going to do that. So that pain, and we talk about shared pain or shared sacrifice. No one, I don't think anyone in this room wants that to be the policy. But we have to figure out, how do we deal with the policy across the state? What makes our state great? Okay. What are the values we have?
But here's the problem with that. And I'll give the opposite example. And I've said this last year before you. State of Connecticut owns and operates a home to take care of severely mentally retarded kids. According to Gene Milstein, our child advocate, not a Republican, not a Democrat, but a child advocate, it costs us as a state almost $1 million per year per child. Go to Holbrook Hospital in Westport, Connecticut, run by St. Vincent's. They take care of the same population. How much does it cost you to care for that population? It's a lot of money, John. It's about $425,000 a year. Well, why don't we ask Holbrook to take care of a couple of those children, pay Holbrook $450,000 a year. They can make a profit. The state will save a tremendous amount of money. At the end of the day, we're saving $30 to $50 million a year, and maybe we're not making that cut.
I agree.
Problem, if we close down this state-run hospital, we have 90 to 120 state employees that now don't have jobs.
420.
420, I'm sorry, Larry. They get transferred into similar positions. Maybe there's bumping rights. But can we get that passed through the legislature? No, we can't. There are difficult things that we deal with. So I think that we need that type of frank discussion. There are things that we do as a state that the private nonprofit sector can do for 50 cents on our dollar. They can do it arguably better than we can do it. We can still provide compassionate care and that safety net, which nobody, Republican or Democrat, thinks we should get rid of, and we can save hundreds of millions of dollars. But doing those things, privatizing, has become a dirty word in the Connecticut state legislature, and it can't be. Because if we can't be more efficient, if we can't provide care to people who need it for less money, we're going to have to cut care or significantly raise taxes. And that's a discussion that we have never had in earnest in the state legislature.
Do you think, I'm sorry, Don, go ahead.
Yeah. Thanks, Mark. Senator McKinney is right. In the way that we manage certain assets in the state, the cost per person served becomes astronomical. The juvenile training school that DCF runs is another example. It was built for about 2 or 3 times the young people that are currently served. The overhead costs are the same, so if you're only serving 1/3 of the folks that you thought you were going to be serving, then per person the costs are so much higher. They're about $400,000 or thereabouts per juvenile who was there at that facility. So those, Senator McKinney's right, those facilities must be managed better. The investment, the reinsurance investment tax credit is a way that we try and promote job growth through tax credits for business. $400,000 per one job created. We ought to apply the very same criteria that we look at general fund spending that we do with tax credit spending as well. Makes no sense to spend $400,000 for one job created. Everyone's going to have to be at the table, and Governor Malloy has already signaled that he's going to invite the unions in. Every aspect of state government is going to have to change, conserve, save, and become more efficient. No question about it. That's my view. If we look at the tax burden that was mentioned ago, that in the context of 2001, 1991, the budgets that got us out of that in 1991, it was about 60% tax increases as compared to cuts and borrowing. In 2001, with Governor Rowland, twice as much in tax increases versus spending, 2-to-1 tax increases to spending. The last biennial budget 2 years ago, the tax increase made up 13% of the $8.7 billion deficit. So yes, taxes did go up, but not like they did in 1991, not like they did in 2002 by comparison. One of the things that hasn't been talked about, because we can get into the weeds on sick days, et cetera, but two huge issues are energy costs and healthcare costs. In the United States, we lose manufacturing jobs to Canada, not because Canada taxes less, they tax more. Not because their winters are less severe, but because their healthcare costs and their energy costs are less. And for so many companies, that makes a huge difference. Nobody's right 100% of the time. The business community and the CBIA a number of years ago said, let's deregulate energy in the state of Connecticut. And we listened, and we passed it, and we went from being in the top half of high energy cost states to the very top. Number 1 or number 2 or number 3, depending on what survey you look at in terms of energy costs. Didn't work, increased costs. We have been fighting ever since to turn that around, and there are some good ideas, and we're going to work with Republicans and Democrats to keep bringing down energy costs. But if we bring down energy costs 10%, we save tens of millions of dollars just for the state of Connecticut, but think of how that ripples out through the business community, small businesses, medium-sized, large, all across the state. The same is true with healthcare costs. When I talk to businessmen and women, those two items come up more often than any other item, and when we reduce those costs in Connecticut, we help grow jobs.
But you would never trade the Canadian healthcare system for our healthcare system in America, no matter how problematic it is.
44 million people who have no health insurance at all would trade it in a heartbeat.
Well, let me tell you
With
something.
with 9 minutes left, I don't know if we can afford a debate on health care right
Well,
now.
we won't debate health care, and it might be interesting to know the percentages of 1999 and 2001. But frankly, I would submit that a lot of people in this room and outside this room don't give a damn about it. Because here's the facts. We lost about 100,000 jobs in the middle of our recession. I don't recall that happening. We lost 15,000 businesses in 18 months. And they weren't saying, but you know, we're lucky because back in 2001, the percentage of taxes were a little greater. I think we are now adding taxes on top of the taxes. That's why we're the highest tax state in the United States of America. My daughter lives now in London. She came home, of course, to celebrate the holidays, but also to get an appointment with a doctor in America, because in London, she had a 6-month wait. So if I were to submit to you that our problems will be solved once we adopt the Canadian healthcare system, I'm not sure there'd be a lot of people here that would agree to that.
But
Well,
we
but
don't
again,
understand the history of the previous recessions and where we've been as a state, then we're going to be doomed to repeat the mistakes of the past.
Well, that's true, but that's true. But when you talk about how we got out of the last budget deficit and we used a lower percentage of tax increases than ever before, why? Because we got billions of dollars from the federal government. Had the federal government been doling out billions of dollars in the prior recessions, we would have taken that money too. We used $1.5 billion from the rainy day fund, and we should have used the rainy day fund over the course of time because it has been raining in the last 2 years. The frustration, though, Mark, when we keep using these terms, shared sacrifice, implies that people haven't sacrificed for the last 2 years. And for the last 2 years, you know, all of us ran for office this year. I knocked on over 1,000 doors, and not a single person that I actually had a conversation with said they hadn't sacrificed. Everybody has sacrificed in the last 2 years, except for government, except for policies and programs. State employees did give in $700 million, and that's a good thing. But in terms of the size and scope of government, there has been no sacrifice.
I mean, just
No,
again,
hang on one second. And this is what I get for insulting Mark Davis, because he would have done a better job of interrupting. I don't think anybody's going to leave here right now with an idea of what any of the four of you are prepared to do. And to be fair to you, I think that shows that you're going to take your lead from the governor. You're going to look at what he proposes on February 16th and play off of that. So let me ask this. There's a new dynamic at the Capitol. For the first time since Governor O'Neill was governor, we're going to have a Democratic legislature, a Democratic governor. Tell me how you see your role changing. I know Larry Cafero was greatly frustrated at times having a Republican governor because of a variety of dynamics that were there. But let me ask, starting with the Democrats, do you view yourselves as full partners, or is he really the leader of your party? He's going to set the direction, and then you're going to try to adjust and influence what he proposes?
actually, I see us as partners. I mean, I teach a government course, and there's 3 branches of government, and one's the executive.
No question constitutionally, it's a separate equal branch of government.
So, right, absolutely. Thanks for interrupting. So we are partners. There's 151 people in the State House. They have ideas. We have committees, and the public comes and testifies in those committees and bring up ideas. We, certainly as a Democrat, the issues that'll be coming from the majority caucus, Democrat issues, are similar ones that the governor is looking at as well. So though I certainly feel that there's a partnership, when I listened to his inaugural address, it was very similar to some of the ideas that we had talked about in our caucus and in the House as well. So I really think it's going to be a real partnership. I really look forward to it. I liked what he said here in terms of the dialogue and everybody participating. I think I have a very positive outlook on that, and I know it's going to be tough. But if everybody feels that they're in, and we want to move the state forward, I think it'll be helpful to everyone.
You know, he is absolutely the leader of the party, and it will be a partner. And I had a very good working relationship with Governor Rell, and I think that she did some good things, especially restoring trust and confidence when she took over as governor. But I think you're going to find that Governor Malloy is an activist governor. He is not only ready to drive the car, he wants to drive the car, even in this time of tremendous challenge. So from that point of view, I think it's going to be a dramatic change. I'm looking forward to it. I want to work with him, and he will be setting, as he already has, the tone and the agenda. And I know when I talk to my colleagues, we're ready to go. I think the state of Connecticut is ready to go, to move in a positive direction. And, you know, just to give you some insights, a legislative task force was charged with the job of coming up with $50 million worth of savings. They came up with, I think, $250 million worth of savings. Democrats and Republicans working together. All the Democrats and all the Republicans voted in favor of these recommendations. One person voted against it, and that was a staff person from Governor Rell's administration. And the reason was there were recommendations to cut manager positions, bureaucracy, things that, quite frankly, we did in the state Senate. We passed measures that would have cut political appointees, that would have cut middle management in a number of different agencies, and we were opposed not so much by my Republican colleagues, but by the executive branch. Once you get in, it doesn't matter so much if you're a Democrat or a Republican, you're in favor of preserving that bureaucracy. The change that we have right now is we have a new governor, not wedded to that dynamic, having been in office for years and years, new time and the ability to change government, make those tough choices that I think many in the legislature are ready to make.
We have a few minutes left. Representative Cafero, Senator McKinney, what's the role of a Republican in the New World Order in the Capitol?
First of all, you know, the election's over. We all have our ideas, we have our ideologies, we have our principles that we ran on. Do we want to work with the governor? You're darn right we do. We want to be partners. But I hate to break it to my Democratic colleagues, he's the senior partner. We're partners, but he's the senior partner. He's the executive officer of this state, and a lot of what we see will come from him. We could talk about Governor Rell. God bless her. She's now a former Governor Rell. We have another Governor Malloy. So we got to stop looking at the past, pointing fingers, et cetera, et cetera. These are the same 4 men that were here for the last 4 years, okay? Same event. You've heard a lot of this before and all this business. We're now going to start. We're now going to start, not before, but now we're going to start. Well, let's start a fresh slate. Let's work with our new governor. Let's work together as a legislature, regardless of who's in the majority, who's in the minority, and fix the state of Connecticut. That should be our attitude.
Senator McKinney?
I agree.
We're ending where we started. They're in total agreement. We seem to be at noon, so I'll call a close to this. Oz, are you going to set us up?
Wrap this up, Mark. Thank you.
You're welcome.
Welcome to the new dean. Thank you very much, Mark. Thank you all very much. Gentlemen, thank you very much for being here. We look forward to working with all of you. We look forward to working with all of you to get this state back on a pro-jobs basis. Thank you all for being here.